Well, thank you very much for the invitation. I really appreciate it. So what I've been asked to speak about today is the importance of your pelvic floor and how to look after it. So we're going to talk about where the actual pelvic floor muscles are. So essentially, they are a layer of muscles that support the pelvic organs, and they basically cover the bottom of the pelvis. So in the organs that they support, that includes the bladder, the bowel, and in women, the uterus. And they are literally like a hammock going from the pubic bone to the tailbone, and then out to the side to your ischial tuberosities, which are your sitting bones that you're sitting on at the moment. So in terms of very simplistic anatomy, the picture on the left here is the female pelvic floor. And so this sort of red line through here are the pelvic floor muscles going from the pubic bone to the tailbone, wrapping around the urethra, the vagina, and the rectum. And in the male, it's exactly the same location from the pubic bone to the tailbone, wrapping around the urethra and also the rectum. Now, the Continence Foundation has just recently loaded up some really good videos of how the pelvic floor works.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back, and from side to side. They support the bladder, bowel and uterus, and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around your vagina, as if you are trying to stop the flow of urine. Lift them up inside. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice as you tighten and lift your pelvic floor muscles, they tighten and close around the anal passage, vagina, and urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back and from side to side. They support the bladder and bowel and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around the base of the penis, as if you are trying to stop the flow of urine. You should see your penis draw in and your scrotum lift up. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice, as the pelvic floor muscle tightens, the anal passage closes. The same action happens to the urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
So with regards to the roles of the pelvic floor, they are very important for bladder and bowel control. They do support the organs. They are part of the core system, and they're very important for sexual function as well. So what can cause the pelvic floor to be weak? Basically, it's like any other muscle. If you don't use it, you lose it. So not keeping them active means they will become weak. In women, being pregnant and having babies will. Constipation can cause weakness, because with constipation, if you're straining, that strains the muscles and the nerves and can damage them. Being overweight can have an effect on them as well because of the constant pressure. Heavy lifting has been associated with causes of pelvic floor weakness, and coughing that goes on for a long time. So not just, a general cough or cold, but things like having a smoker's cough, bronchitis, or asthma, so chronic cough conditions. Surgery or trauma or other health conditions can cause weakness of the pelvic floor muscles. And so particularly here, things like men who have prostate surgery, people who have surgery on their bladder as well, and just basically getting older. They're like every other muscle. As you get older, they get weaker. And like every other muscle, if you keep using them, you can help to slow down that weakness, prevent it, or actually improve your strength as well. So in terms of vaginal delivery, what's the issue here? So basically, the main thing is that there's weakness caused by damage or stretching of the pelvic floor muscles, but also the connective tissue, so the ligaments, the fascia, and the nerve. So it's really important to know that the nerve is like the electrical system of the body, and when it fires, it makes the muscle contract, and when it relaxes, the muscle should relax. So consequently, it's not just about the muscle, it's the nerve supply as well. So then the question is, well, should everyone just have a cesarean if that helps to protect the pelvic floor? And the answer is actually no. Cesarean is not always protective because we now know that pregnancy itself can be equally as damaging as the actual vaginal delivery itself. So in terms of hormones in the pelvic floor, so in women, pelvic floor muscles work really well when you have lots of estrogen. So estrogen is reduced through all lifespan for women, so with breastfeeding, menopause, and certain medications. So certainly some medications related to cancer treatment can put women into premature menopause, and therefore the estrogen is not circulating and the pelvic floor muscles don't work as effectively. And for men undergoing hormone therapy for prostate cancer, or ADT, androgen deprivation therapy, that also affects the way the pelvic floor muscles work, and in particular creates weakness and loss of endurance. In terms of medical treatment, so radiation therapy, so any treatment of pelvic cancers can damage the pelvic floor muscles. And how this occurs is it actually affects the actual structure of the muscle. And when the structure of the muscle is affected, the function is. And so with regards to radiation therapy, the effects may not be immediate and may take 6 months or so to actually present. And that's because of the delayed changes within the muscles and the fibrotic changes, so the thickening that happens within the muscle. In terms of prostatectomy for prostate cancer, the issue with this medical treatment is, as I described before, the nerve supply is super important for the muscles working. And so in this instance, the nerve supply to the pelvic floor can be damaged. And this can be one of the causes of weak pelvic floor muscles after removal of the prostate for prostate cancer. Now, some of the symptoms of pelvic floor weakness are incontinence, and that can be the bladder or the bowel, so leaking urine or feces and actually having trouble controlling wind also falls into that category. Pelvic organ prolapse, which I will talk about a little bit more. If you have a weak core, because the pelvic floor is part of the core, that can be an issue. And also there can be reduced sexual function. So for women in particular, it will be with regards to satisfaction and orgasm, and with men, it will more likely present as either erectile dysfunction, or it can also present as pain. So if we have a look at lots of different types of incontinence, so specifically the bladder, if the audio came through for the female video that I had, it would have said that you can leak with coughing and sneezing and exercise, etc. That's actually what we call stress incontinence. Now, stress incontinence is not because you're stressed or anxious, it's because there's a stress or pressure placed on the bladder. And so this is the involuntary loss of urine on effort or physical exertion, or on sneezing and coughing. And so what this picture over here depicts is you have an empty bladder. As the bladder fills, it takes up more space. When there's pressure within the abdomen, which can happen when you bend over, when you cough, when you sneeze, when you laugh, if the muscles down here are not strong enough to overcome that pressure, that's why you have bladder leakage. Now, there's another thing called overactive bladder. And so with this, there's usually urgency. So what urgency is you need to get to the toilet and you've got to get there quickly. And if you don't get there quickly, you think you might have an accident. So there can also be increased frequency of going to the toilet for the bladder and getting up at night. And with overactive bladder, what can happen is you just urgent, frequent, need to get there, but you have no accidents, or you can have accidents as well. So that's when you'd have urinary incontinence. Now, when diagnosing overactive bladder, it's really important you exclude any other pathology. So in particular, urinary tract infections, but with regards to other causes, it can be things like bladder cancer, because there's an irritant within the bladder that's affecting the way it's working. And so the capacity might have been affected. So then the frequency increases. And so that can even include getting up at night more, as per the definition. So in a normal bladder, the bladder is actually a muscle itself. It will stretch. And when it stretches, it gives a message to the brain that you need to go to the toilet. That usually occurs at around 270 mils. When you have an overactive bladder, that message going to the brain telling you need to go to the toilet often occurs at much smaller volumes. And that can be anything from 50, 100, 150, 200 mils. And so when you don't hold as much, you go to the toilet more often as well. So overactive bladder can be associated with stress. So we know that people who are under a lot of personal, financial, social stress, anxiety, for instance, can experience overactive bladder. Definitely caffeine, fizzy drinks, and alcohol can cause overactive bladder as well. So in particular, caffeine is a diuretic. So it makes you need to go to the toilet more often. And there are certain health conditions that can affect the brain, such as having a stroke or Parkinson's disease, that can cause overactive bladder. So we know that the message goes from the bladder up to the brain telling you need to go to the toilet. And because we're humans, we can decide to go yes or no. When there are changes in the brain, such as stroke, Parkinson's disease, and actually aging, your ability to turn off that message that you need to go to the toilet is affected. And so then you need to go to the toilet more often. Constipation can cause overactive bladder as well, because there's pressure in that area, and just poor bladder habits. So going to the toilet when you don't need to means your frequency increases, or you wake up at night for some other reason, like the dog next door is barking, and you think, oh, I'll just go to the toilet, or I'm not going to be able to get back to sleep. So if I was to look at how many times you go to the toilet, I could be thinking you have overactive bladder, but it's actually just that you've got some bad habits. So we'll go through what are some good habits with regards to looking after the bladder. But certainly general rule of thumb is, unless you need to go, don't go. Now, mixed urinary incontinence is where you basically have overactive bladder combined with stress incontinence. So you can leak with a cough and a sneeze, or you might have an urge as well, and then you leak as well. So it's a combination of the two things put together. This is more common in older people than in younger people. And again, that's partly because of muscle changes with aging, as well as those brain changes I was saying about trying to dampen down the messages. So what I want to make clear is bladder problems are not just a function of old age, okay? So we know that incontinence affects 5 million Australians, so 1 in 3 women and 1 in 10 men, but I want you to realize it also affects 1 in 5 children in Australia as well. 70% of people that have bladder leakage don't actually seek help for their problem. And so consequently there we've got a whole bunch of people who could be getting help and improving their quality of life that don't seek help. So in terms of, you know, is it an aging thing? Hopefully you've realized from those statistics it's not. Children also have problems. And if we actually look at younger people, so in their late teenagers, early 20s, we know that 1 in 7 18 to 22-year-olds and 40% of 45 to 49-year-olds have leakage with sport. So you would typically think that people were fit and active wouldn't have problems with their bladder, but they actually do. And as a result of that leakage, up to a quarter then avoid sport due to their incontinence. And so the important thing to take from this is we know that we need to exercise. There's much research out there of the benefits of exercise for our muscle strength, our bone health, our heart health, our lung health. It can be a modifying factor for cancer as well as mental health. So if people are avoiding sport because of their incontinence, this has ramifications for the rest of their health as well. So we know that more than 25% of high school and college female athletes have incontinence, yet 90% or more were never told anyone that there could be preventative measures for this. And so thank you for having me speak today, because this is another way of getting the message out there. And whether or not, you know, you take something home from today's meeting or not, you know, you might be able to help your granddaughter or your daughter or your son from the information you get tonight. So if we talk about fecal incontinence, so this is where there's loss of control of bowel action. And with regards to this, it's either you lose actual fecal matter or flatus, so wind. So it's not as common as bladder issues. So it's about 1 in 20 people. Common causes of it are, again, comes back to pregnancy and having children, getting older, some types of surgery. So definitely patients who've had colorectal cancers, for instance, or radiation therapy. Constipation is a cause of fecal incontinence as well. And so one of the reasons for that can be that the bowel is full and they can't pass the bowel motion, but what does pass is the liquidy loose stuff, and that sneaks out as more of a liquid loss of bowel motions. Severe diarrhea can also be a cause of fecal incontinence. So when you think about some of the treatments you're undergoing at the moment, some of those treatments can cause some of these things, so constipation, diarrhea, etc. So don't just be thinking of just your bladder, you need to think of your bowel health as well. Now, on our website, we actually have a continence screening survey with some really simple questions about, they're just yes, no answers about whether or not you may have problems with your pelvic floor. You can just go on there, do that. If you then would like more information, you can then contact us and make an appointment, but it's a little screening thing. And essentially on that survey, if you answer yes to anything, you've actually got a problem. And so they're all things that could be assessed and potentially treated. I said I would talk about pelvic organ prolapse a little bit later, and this is the time. So the pelvic organs are the bladder and the uterus in women, and the bladder and rectum in both men and women. They're held in place by fascia. So what fascia is, you know, if you get a piece of corn silver side and it's got that silver covering on it, that's fascia. And we have heaps of it in our body, and it actually helps to hold everything together. It's kind of like a main structure of holding the organs together. So the organs are held in place by fascia, ligaments, and the pelvic floor muscles, and all of this attaches onto the bony pelvis. Now, if the fascia or ligaments are torn or stretched, or you have weak pelvic floor muscles, what can happen is the pelvic organs can actually sag down and bulge down. And in really significant cases, in women especially, they can actually come out the vaginal opening as a bulge from the vaginal wall. So symptoms of prolapse are a heavy sensation or dragging in the vagina, something coming down or a lump in the vagina. So when you wipe or wash, you feel that lump. And sexual problems, which can be pain or less sensation. Your bladder might not empty properly and the stream might be a bit weak. Urinary tract infections can occur because the bladder's not emptying properly, and it might be hard for you to also empty your bowel. The main causes of prolapse are childbirth, chronic coughing again, which we talked about as damaging the pelvic floor muscles, heavy lifting. Now, a lot of people think heavy lifting is, you know, having a heavy job, you know, so nurses, factory workers, etc. But there's also quite a bit of heavy lifting at home, especially if you look after small children, whether they're your own, grandchildren, family, etc. Constipation, because that chronic straining actually can make the bowel prolapse, and returning to high impact activities too soon can also cause prolapse. Now, in terms of the core, you know, it's a term that's sort of thrown around a lot, and some people aren't familiar with what the core actually is. So if you think about from your ribs down to your pelvis, that area in there is the core. So the top of the core is the diaphragm. The front of the core is your abdominal muscles, in particular transversus abdominis. The bottom is the pelvic floor, and then up the back of that cylinder are the back muscles multifidus. So you can appreciate this hammock of the pelvic floor. If that wasn't there, essentially everything would fall out. So it's really important for being able to handle pressure when the diaphragm pushes down or when the abdominals come in. But the pelvic floor, because of the attachment through the spine, helps to create some stability as well. So they're very important muscles for spinal support, core stability. They also have a really important role with regards to sexual function. So orgasm in both men and women, the lubrication process. But in terms of actually fertilization and falling pregnant, they're also very important, because in this picture A, you'll see that everything's pretty much closed. When the pelvic floor muscles contract, it actually creates this sort of balloon effect so that the sperm can actually get to the egg and stay there, helping with the fertilization process. And in particular, they're very important with regards to erection in men. So you've probably thought, oh, people have mentioned the pelvic floor before, or I've heard about it. You know, how do I actually know if I'm doing them properly? Well, the majority of people don't know they're doing them properly. So there is a statistic that 70% of women aren't doing the exercises correctly. Even if I was to give you a handout or you listen to this talk, 50% of women will still do it incorrectly. And even women who've seen a pelvic floor physiotherapist after one appointment, up to 30% still can't do it properly. So if you're not sure you're doing it correctly, they're not easy muscles to find and use. And when it comes to men, research has shown that only about 1 in 8 men can actually do the exercises properly. So essentially, it does require assessment, and then from that assessment, an individualized program to be done. So what is a correct pelvic floor muscle contraction? So if we think about women first, it is, as the video showed, it is a squeeze and a lift from the pubic bone to the tailbone, sorry. And you will get what's called anterior draw. So there'll be a pull towards the pubic bone. You definitely shouldn't hold your breath, and there should be no accessory muscle recruitment. So definitely no squeezing the buttocks, no tightening the abdomen, and no pulling the legs together. So a lot of people will say, oh, you know, I've got to rush to the toilet, I cross my legs. That's actually not using your pelvic floor muscles to do that. Now, so an incorrect contraction or tightening of the pelvic floor muscles will mean that on the right-hand side here, the abdominal muscles come in, there'll be breath holding, which means the diaphragm comes down. And so what that means is everything pushes down, when what should be happening is everything should be pulling up, and you should just be breathing your normal breathing pattern. Now, for men, it's similar, but when it comes to bladder control, it's slightly different. So it is still a squeeze and a lift from the pubic bone to the tailbone, because you can't isolate the anus away from the rest of the pelvic floor muscles. So what should happen is you'll actually get some penile indraw. There will sometimes be some scrotal lift, but if you're cheating with your abdominal muscles, you've actually got a really little abdominal muscle that can cause scrotal lift as well. So if you're going off just the fact that you can get scrotal lift as you're doing it correctly, just make sure the abdominals aren't working at all. And as with women, no breath holding and no accessory muscle recruitment, such as tightening your gluteal muscles, so your buttock muscles, your legs, or your abdominals. So how to not exercise the pelvic floor muscles. So we discourage stopping and starting the flow when you go to the toilet. This can mean that the bladder doesn't empty properly, and what it can also do is predispose you to urinary tract infections. We discourage you from doing hundreds of exercises a day. This is a muscle, and as all muscles can become tired and fatigued, so can these muscles. And a lot of people think that pelvic floor muscles means you need to do them on the floor. It's actually not the case. So lifting and lowering your pelvis, as in this picture of someone doing a bridging exercise, is not doing pelvic floor exercises. As I said previously, there should be no tightening of the buttock muscles, no squeezing of your legs together, no holding your breath, or no tightening the tummy really hard. So there's lots of no's, isn't there? Now, exercises to actually look after your pelvic floor. If you have female and you have any symptoms of prolapse, which I discussed in the previous slide, you really should be assessed before you resume any medium to high impact exercise. High impact exercise is considered running, skipping, jumping, and heavy lifting. And that heavy lifting doesn't mean you have to be at the gym. That could include being in the garden, renovating your house, lifting children. And if you want a little bit of a guide of what exercises you can do when you don't have very strong pelvic floor muscles, you can go to this website, Pelvic Floor First. So this website was developed by the Continence Foundation of Australia in conjunction with pelvic floor physios. It is entirely designed for the general public and the fitness industry, so it's easy to understand and follow. And if you were to go to the tab of pelvic floor safe exercises and click on there, it does give you core exercises that are safe, cardio exercises, resistance exercises, and the first drop down from there also will show you some videos and pictures of some exercises you can do. So they just revamped it last year, and it's much easier to use and follow, and it's a really good website to look things up. So how do you know if the current exercise you're doing is too hard? You are actually leaking while you do your exercise or workout. If you're working in a class situation, you have to run out and go to the toilet and only pass small volumes. You may have those symptoms of prolapse, which is the heaviness or bulge in the vagina. And it's also an indication that your exercise is too hard if you're having to hold your breath to do the activity. And as we talked about, when you hold your breath, it pushes the diaphragm down and it pushes on the bladder and the other organs. All right, so let's do some exercise now. So I'm not sure where everybody is, but if you can try and sit up straight for me. So this will work better if you're in a chair. And so if your feet are flat on the ground, you're sitting up straight. For the women, I want you to think a drawstring. So you know how a drawstring puckers in and pulls up? Vaginally, I want you to think pucker in and pull up behind your pubic bone. And for the men, I want you to think the same thing, but trying to pull the penis up behind the pubic bone. So if everyone can just try and tighten and hold it until I say let go. All right, now let go. So what you should have felt is it should have come up and it should have gone down and nothing else should have worked. No abdominals, you shouldn't have squeezed your buttocks. If you squeeze your buttocks, you're sort of riding the horse like this, or you're holding your breath, which means your shoulders are going to come up. All right, so let's try one more in straight up sitting. So I'll get you to tighten again in the way I previously described and hold that. And now let it go. Think about where you felt that. Now what I want you to do is to slouch down in your sitting position and try the same thing. Now when you try it in this position, you should actually feel it more towards the anus, so the back passage. Come back up straight now and tilt forward onto your pubic bone. And now tighten. And now you should feel it more towards the pubic bone. So if you're having trouble feeling it in that upright position, you can try those other 3 sitting positions to see how it feels. In some people doing the exercises lying down, it's actually harder than sitting. So lying, we don't give exercises in lying very often because it's not very what we call functional. So most people don't have trouble with their bladder in a lying position. It's more when you're upright. And then the job now is to try and make sure that you can do some quick ones as well. So what I want you to do is tighten, let it go, tighten, let it go, tighten, let it go, tighten, let it go. Now, the mistake most people do when they do that is their belly goes in and out, in and out, in and out. And that's because you're holding your breath to do it. So try it again and make sure the tummy's not working. And to do that, put your hand on your belly. All right, so tighten, let go, tighten, let go, tighten, let go. Good. All right, so hopefully the take-home messages from today is only go to the toilet when you need to, okay? Limit your caffeine, alcohol, and sugary drinks because they're not healthy for the bladder. You should be drinking by Australian guidelines 1,500 to, that should say 2,000, not 200 mils, sorry, of fluid. Now, when you're undergoing treatment for bladder cancer, sometimes there can be some different recommendations that are provided with regards to total fluid intake, and you should confirm that with your treatment team. Definitely don't do any flow stopping for the reasons I said of not emptying properly and potentially getting urinary tract infections. And it's super important that you take your time on the toilet for both your bladder and bowel. So when I say on your toilet, that includes men who stand to wee as well. Just take your time, let it empty completely. Don't push, don't strain, don't try and use your tummy muscles to push it along quicker. Don't stop the flow and just be relaxed and let it come out. Now, do need to try and avoid constipation. So one of the ways of doing that is with your bowels, so different to the bladder, go to the toilet when you have the message. So the general rule of thumb with your bowels is go within 5 minutes of getting the message. When you do go, ideally you should sit in this kind of position. So with this position here, you're leaning forward with a straight back, a stool under the feet to raise the knees higher than the hips, and then lean forward onto the forearms. This will relax the abdomen so you can bulge it out. But what this position does is it straightens the anal canal so things can just fall out a lot easier. Eating 30 grams of fiber will also mean that it helps you to have a soft stool motion that's easier to pass. And definitely no straining on the toilet because we talked about how that damages the nerve and the muscle. only lift within your capacity. So the key thing here is learn to say no, okay? If you're gardening and you want to move a heavy pot, then get a trolley, get somebody else to help you, but don't strain too much. Maintaining an ideal body weight is helpful for the pelvic floor. Regular general exercise will help maintain that ideal body weight, but will also improve your overall fitness. And sensible exercise routines if you've got pelvic floor dysfunction. So that's things like bladder and bowel leakage, pain, incomplete emptying of the bladder, constipation. And so to find a sensible exercise routine, you can go back to that Pelvic Floor First website that I referred to. Now, pelvic floor exercises, hopefully you've realized what I said, are muscles exactly the same as your bicep muscle, your quadricep muscle. They're just muscles. So like any muscle in your body, you do need to exercise it for the rest of your life, okay? Another exercise that you can do for the pelvic floor is called the knack. And so this is where you consciously think to tighten in exactly the same way we practiced before you do something like a cough, sneeze, lift, push, pull, carry, bend over and stand up. So in this situation, before this person stands up, they would have been sitting, tighten their pelvic floor muscles, stand up, keep it tight for the first couple of steps. Now, if this person goes to cough or sneeze, they're going to tighten the pelvic floor muscles before they cough and sneeze. Now, a lot of people say to me, oh, but it just comes on too quick. I can't tighten my pelvic floor. My response to that is you've been taught since you were a child to cover your mouth before you cough and sneeze. It's just a new habit you have to learn. And if you're quick enough to cover your mouth, you're quick enough to tighten your pelvic floor muscles. So it's just practice and making it a new habit. Now, you should really seek help if you have any symptoms. So bladder or bowel control problems, not emptying properly, pain, those symptoms of prolapse. We know that continence and pelvic floor physio can help to improve or cure most conditions, not all, of the pelvic floor. And in cases of mild stress incontinence, so remember that's the one with coughing, sneezing, laughing and physical activity, there's actually an 84% cure rate for people with mild stress incontinence. I think the important thing is the statistics show that this affects over 5 million Australians, so you're not alone. It doesn't mean you have to put up with it. So when it comes to bladder cancer, in terms of the role of a physio and pelvic floor, is to make sure you're looking after your pelvic floor properly, not damaging it further. So some of the hints that I've given you tonight, but especially in patients who go on to have a neobladder, we know that the pelvic floor muscle is really important in being able to control some of the leakage that can occur. So with some of the people that we work with, we like to see them before they have their neobladder done so that they understand how to tighten the pelvic floor muscles, how to relax them, when to activate them, and get them on a program before their surgery. And then when they have approval to continue their program afterwards, they know what they already need to do because they were able to use the muscle pre-surgery. So it's just a case of getting things going again after surgery. And so we usually follow up a number of times after surgery to upgrade the program and make it specific to the person and the issues they're having. For the patients who don't undergo surgery, of course, this is bladder cancer, your pelvic floor muscles still do other things. So we're still trying to look after the bowel, we're still trying to look after the organ support as well. So it's important not to forget the other roles of the pelvic floor. And certainly if you've undergone a lot of abdominal surgery, often your core is not very strong. And so consequently, strengthening your pelvic floor muscles can help that as well. Now, this is just some general information about if you'd like to make an appointment, you can actually refer yourself unless you are coming under a coverage of something like Veterans Affairs or Medicare, but that's the number there.